and welcome into To Your Health. And we have with us today the CEO of Baptist South, Peter Selman, and we've got something so exciting going over there. Peter, we've been talking about it now. Your new expansion to the ER is open.
It is open.
So walk us in.
Yeah, we're really excited. So this is a 30-bed expansion, about 11,000 new square feet. It's about a $14-15 million project, and something we're really excited about. The good news for most of your viewers is that during construction we did have to have a temporary entrance, and it made navigating around our campus a little bit of a challenge. But the great news is we're back to the original entrance. Okay. So if you're coming by private vehicle, if you're coming in your own car, it's the same entrance that faces Southern Boulevard and the Alpha building that we've had for years. There is improved parking.
Great.
And there's a circular driveway with a covered canopy, so you can pull right up to the front of the ER. If you come by ambulance, don't worry about it. They'll take care of that. It's in a separate entrance. But it's really very, very convenient. We have directional wayfinding signage throughout our campus to get everyone. Because in a moment of an urgent emergent situation with yourself or a loved one or a family member, you're a little bit emotionally hijacked.
You're exactly right.
Having that directional signage is very important.
We all need it.
Yes.
So when we get there and when we get in, what can we expect?
All right. So when you enter the doors, you will be greeted by a security guard, and for the safety of all of our visitors. But if you're in a critical situation, they quickly bypass, and there's a nurse who is stationed right there in the ER with eyes on the front door. And so they can pick up on very quickly if someone is in distress and immediately triage that patient. So what we mean by triage is really just a quick assessment of whether someone is in distress or someone that just needs to be go through the process of diagnostic testing and so forth. So I know that there is some confusion about that, about, first come, first serve, but in an emergency situation, oftentimes we've got to pull back that person immediately, and we appreciate everyone's patience as we get to everyone kind of based on the criticality of their illness or injury. So you'll come in, maybe go through security, we'll get you registered so we know all your information, and then we'll get you into triage. You'll be evaluated by that triage nurse, and then we'll get some things cooking for you. So probably some lab tests. We'll probably take a specimen, take it to the lab. It's amazing what just a little bit of blood will tell you about a person. Oftentimes our patients will have some diagnostic imaging as well. So this is ultrasounds, x-rays, MRIs, CAT scans, CT scans, etc. Those tell us a lot about what may be going on with someone. So you'll come in, whether you're in what has traditionally been our ER or in the new 30-bed space. We're going to get you in a place that's comfortable, convenient, with state-of-the-art equipment and supplies. But most importantly, it's the great team that we have, the staff that we have.
You do, and you have their extent of caring. And you know, we've always talked about the two things that you need as doctors and nurses and all of your other staff, actually everybody, and it's competence and compassion.
Absolutely. Because
you are at your total most vulnerable when you're sick.
Absolutely.
You know, and it makes such a difference to have somebody who is, you can tell, is caring.
Yeah, it's really unique when you think about it. And it's a small percentage of people in the world that are wired to do that. So I use kind of the metaphor of pregnancy, something I will never fully appreciate, right? And that is
Count yourself lucky.
I'm sure.
Ouch.
A lot of your viewers agree with that. The good Lord was wise enough to give parents 9 months to warm up to the idea of selflessness, right? And that how much their life is about to change. And then we love that child the moment they're born. This doesn't take a relationship to be, but particularly in an emergency room setting, the patient is coming through the ER. You likely have no idea who they are. They may have nothing in common with you. And our expectation is that our team members treat that patient, regardless of where they came from, and treat them exactly as if it were their loved one. And not everyone has the DNA to do that, to wire. So I tell our team members all the time about how special they are. So we are so blessed to have wonderful doctors, nurses, therapists, technicians, pharmacists, and then we have an entire team of non-clinical professionals who support them, who may be not right at the bedside, but are supporting the people at the bedside. And we are very blessed. We have 6,000 team members in Baptist Health, which makes us the largest non-government when you take Maxwell Gunter as the federal government, and then of course we're the state capital, so we have a lot of state employees. But outside of that, Baptist Health is the largest employer in the River Region. We take that responsibility very seriously.
Well, thank you so much. We're going to continue to get everybody well, and we will be back with you again next week. Thanks for being with us.